Professor Mendoza, thanks for your time this morning.
Good morning, Michael.
What's your view on what Julia Gillard announced in terms of mental health yesterday?
Well, what the Prime Minister outlined is really a series of initiatives aimed at aspects of suicide prevention. It's not a mental health reform package. It falls well short of any sort of really clear direction and certainly nowhere near enough funding to change the fundamentals of our mental health care system.
What more should she have done?
Well, I think, Michael, what's apparent is the government's taken a sort of a scattergun approach in the announcement yesterday. They've put a lot of small amounts of money into existing programs, which will grow those programs, but most of them grow by very small amounts of money. Now, if the government is of the view that they couldn't find any further money, then it would have, I think, been preferable to take a more targeted approach to ensure that one area was fully funded so that it would at least be able to stand on its own, so to speak, in terms of a program or a service within the national mental health system. It's a big contrast, I think, to what the opposition has outlined to date. The opposition has decided that on all of the available evidence and advice, their best buy is to invest in early intervention programs and the early psychosis programs and not sort of quib on how much it's going to cost, but fully fund it. And so within 4 years, the Coalition is really committing to a full rollout of early intervention and early psychosis programs targeting young people, who are the people we see most missing out on any mental health service at the moment and when mental health problems first arise. So there's a very big contrast between what the government's outlined and what the Coalition has outlined to date.
Given the funding constraints Julia Gillard keeps telling us the federal government is under, isn't ploughing money into an area like suicide prevention a good first step?
Look, it is worthwhile. Every one of those initiatives yesterday are worthwhile, but I would put the point that many of them will not be anywhere near sufficient to make a substantive dent in the suicide numbers or the self-harm numbers that we have in Australia. Just take the example of the funding that's been pledged for suicide hotspots, $9 million over 4 years, and we learned today that the gap in Sydney, which was mentioned in the Prime Minister's speech, where one death per week on average happens, one completed suicide there every week, 50 a year, and that area has not been earmarked for any of these funds, and even if it were, you would only see three preventative measures put in place at a hotspot. That's simply not an adequate national approach. This smacks of, if you like, a grab bag, quickly, hastily put together by bureaucrats to try and counter the criticism, rather than a strategic, very targeted approach to either suicide prevention or mental health reform.
We're talking about suicide hotspots. What about Indigenous mental health, an area that is of great and growing concern to a lot of mental health experts? What can you see in the government's announcement will help combat problems in that area?
Well, Michael, there's a little bit of funding in the 270-odd million package announced by the Prime Minister yesterday, but it's very small again. So there's a little bit of money for community development projects where communities might have a proposal to do some local activities costing, taking young people to another place to have different experiences, taking them on camping experiences and things like that. They're all worthy again, but again, these don't make a difference in terms of population outcomes, population health outcomes. And we don't see enough money being specifically targeted to ensure that really good programs like one developed by Professor Ernest Hunter in Cairns is available to all Indigenous communities. It's a web-based program and it's only available in a limited number of areas. So again, rather than really building those programs where we have good evidence and good success and ensuring that they're universally available, Labor has thrown the money in a sort of a scattered approach rather than a targeted and strategic approach.
So when Julia Gillard and Nicola Roxon say mental health is going to be very much a second-term priority for the Gillard government, what do you take from those words?
Well, I'd like to be optimistic about this, but on what the government's pledged so far in terms of the early psychosis program, these are the programs that ensure that young people who start to develop psychosis have access to effective services. We know we need about 20 of those centres nationally. Now, the government's pledged $25 million over the next 4 years. Each one of these centres costs $13 million per annum to run. It will take until the end of this century, not the end of the decade, the end of the century, in order to have the 20 centres on that sort of funding commitment that we've got at the moment. I think Labor really needs to go back to the drawing boards. They need to take on board the advice that the National Health and Hospital Reform Commission provided, the National Advisory Council I used to chair. The advice is there. The government is better informed than any government previously about what to do in this area, but it's really failing to take that advice on board, and instead it's sticking with the largely failed approach for mental health reform that we've seen over the last 20 years.
John Mendoza, I really appreciate your time this morning. Thank you.
Thanks, Michael.